Hi, I'm Dr. Marie-Michelle Simbolon-Cloa. I am an internist gastroenterologist here at Adventist Medical Center, Manila. Today, I'm going to shed light on the different types of viral hepatitis. Viral hepatitis, by definition, are viruses that can cause inflammation of the liver, or what we call hepatitis. The different types of hepatitis viruses are hepatitis A, B, C, D, and E. There is another one, which is hepatitis G, which does not cause any disease. Now, as to the mode of transmission, both hepatitis A and hepatitis E are acquired through ingestion of contaminated water or ingested of contaminated food. On the other hand, hepatitis B, C, D are transmitted through contaminated body secretions as well as blood products. Now, among the different types of viruses, there are only two vaccines available, and these are both for hepatitis A as well as hepatitis B to prevent disease. And now let us go about the difference between acute hepatitis versus having chronic hepatitis. First of all, both hepatitis A and hepatitis E do not cause chronic disease. When you say chronic disease, it means the virus is present in the body for more than 6 months. But both hepatitis B and hepatitis C can cause chronic liver disease. For the manifestation of viral hepatitis, most commonly, it is asymptomatic, even in acute stage. They may present only as body malaise, fever, or some flu-like symptoms. Sometimes they may present with yellowing of the eyes, or what we call jaundice. Now, for both hepatitis B, C, and D, which can cause chronic liver disease, they may present with complications like yellowing of the eyes, enlargement of the abdomen, bleeding tendencies, as well as having edema. Let us now go to a discussion on chronic hepatitis B. Why is it important to talk about hepatitis B? Because the Philippines is endemic for hepatitis B. According to the Hepatology Society of the Philippines, patients with hepatitis B in the Philippines comprise 16% of our population. That is almost equivalent to 8 million. And the mode of transmission, as mentioned before, is through body secretions as well as contaminated blood. In the Philippines, the most common mode of transmission is through perinatal, or what we call vertical transmission. So it usually arises from a baby being delivered from a contaminated or infected mommy. And there's also what we call horizontal transmission in the childhood stage, wherein among the playmates or among the relatives in close contact, the virus can be transmitted. In the adult, hepatitis B is transmitted through sexual contact, especially if you have multiple sexual partners. Now, it is also acquired through contaminated blood, even in minute procedures as having your dental procedures or even visit to your salons. For the diagnosis of hepatitis B, you need blood examinations, including liver function tests and, of course, ultrasound. There are only few sets of patients who are candidate for treatment for hepatitis B. The purpose of treatment for hepatitis B patients is to retard the progression of the disease and minimize complications as a result of hepatitis B. And these are liver failure, liver cirrhosis, including liver cancer. So, liver cancer is one of our top cancers here in the Philippines, and mostly these are attributable to hepatitis B. So there are available treatments for hepatitis B, either tablet form or in the past there were injections. But you need to discuss this with your doctor. Now, I have to mention that hepatitis B infection does not happen in the absence of your hepatitis B. So if you're going to treat hepatitis D, you have to treat the hepatitis B. So if you're going to treat hepatitis B, you're also addressing hepatitis D infection. For patients with hepatitis B, that means if your mother or brother or sisters have hepatitis B, then you need to be checked also for hepatitis B. Now last, let's talk about hepatitis C. Hepatitis C is a virus, once again, that can also cause chronic disease. Now, hepatitis C, just like hepatitis B, is transmitted through body secretions as well as contaminated blood products. especially those patients who are receiving blood transfusion. So as mentioned, patients with hepatitis C in the chronic states can also present with complications like liver cirrhosis, liver cancer, as well as liver failure. So for the treatment of hepatitis C, unlike hepatitis B, they have already found a cure for hepatitis C. So you need to go to your doctor to discuss the treatment options for hepatitis C so that you can get cured. Also, if you have a brother or a sister or parents or partner who has hepatitis C, or if you suspect that you have been infected by hepatitis C, go see your doctor. At Adventist Medical Center Manila, we have a team of gastroenterologists that manages patients with viral hepatitis, including its complications. And also in this hospital, there are available tests including blood examinations and ultrasound that can determine what kind of hepatitis or what stage of hepatitis that you have in your body. So once more, please visit your doctor if you suspect or if you have relatives that have hepatitis. Thank you.